following information is presented for discussion and educational purposes only and is not intended or provided as treatment information for any specific person or behavior. If you or a loved one is having behavioral difficulties, you are encouraged to seek professional consultation as soon as possible. Ladies and gentlemen, welcome back to part 2 of episode 24 of Ask the Behavior Doctors. This is our potty training special, where we're going to be giving you some specific recommendations and ideas for potty training your child. So remember, last week our question was about Dr. Jake, what do I do with my child? How do I get them potty trained? What are the basics? What should I look for? How do I know if they're ready? And if I do know they're ready, what do I do? So again, my name is Dr. Jacob Bonet. I'm here in Scottsdale, Arizona at Scottsdale Pediatric Behavioral Services. And we are going to talk about potty training today. So I'm going to give you a basic plan full of general recommendations. Obviously, if your child has had any issues, if you failed at potty training before, if your child has any bowel issues, major medical issues, irritable bowel syndrome, digestive issues, you probably want to consult a medical doctor before doing some of this stuff. But for the typical child, these general recommendations should be quite effective. I will say here, we've probably minimum had at least 60 potty training cases in the last few years, and we've been able to successfully help every single patient eventually be able to void in the toilet. So it's something we're really proud of here. So the very first thing you want to do when setting up a potty training program is you want to make the child as motivated as possible to go to the potty. So part of that is you got to start with the biological motivation. So I tell parents you're going to want to buy lots of preferred food and lots of preferred liquids for your child to consume. Some parents are like, well, aren't I going to ruin my child's diet and aren't they going to get used to all this candy? No, you should plan to be able to do this in a long weekend. I would probably start on a Friday, maybe Friday during the day or even Friday evening if you want. So you're going to load your child full of food and liquid, because when you do that, you're going to give them lots of opportunities to practice voiding, and you're going to make it more likely that they become aware of what that sensation feels like biologically to have to void. So you're going to want to really start with your child's biological motivation by getting them as full as possible with food and liquids. The next thing you're going to want to do is you're going to want to make sure that the bathroom is a fun place. The place where they're going to void should be a very enjoyable place. You're going to want to make sure that it smells good, that it's comfortable. You might want to consider getting like a potty seat for your child. I'll take this opportunity to answer a question too, the most common question. Parents ask me about potty chairs. So they ask me, doctor, should I get my child a potty chair? Like one of those little chairs they can sit in or one of those little play toilets. I don't like them generally. And the reason is because they don't look like a realistic toilet and they're big and cumbersome. So where are you going to bring that toilet to besides the home? It doesn't generalize to other toilets. I'd like your child to start and to learn how to use the potty on a normal sized toilet, because we want them to be able to go out to the store, go out into public, go to other people's homes and be able to use their toilets. And something that looks like a normal toilet is obviously going to be much easier to generalize to multiple locations and multiple environments. That's the biggest reason I see it. Number 2 is it's just unnecessary. Yes, it's comfortable. Yes, it's playful. Yes, it looks child friendly. However, I've taught many children to void in normal toilets, and a little potty chair is only going to be useful for so long. They're going to get bigger, larger. It's not going to be comfortable. You're not going to be able to bring it to multiple environments. Again, it's only a temporary solution. Voiding on a real toilet is something that can be sustained throughout their lifetime. So again, I don't see a lot of need for it, and I see a lot of cons against it. So my recommendation is don't use the potty chair unless you absolutely have to. And we'll talk about that at the end here. So when you are pumping your child full of food and liquids, I want to go back to this. I want to make sure that they're taking bites or sips every 1 to 3 minutes. So what I want you to do, let's say they're watching a movie or playing with a preferred toy. I just want you to briefly and gently block access to that show or toy. And I want you to Say, okay, time to take a bite. Okay, time to take a drink. I want to make sure they're taking a bite or a sip every 1 to 3 minutes as much as possible. You want them to be full of that food and liquid. Make the restroom fun. It needs to be the most preferred environment in the home during that potty training time. Okay, make it fun. Have a good attitude. Be very fun, be very playful, be very animated. You want the bathroom to be fun because obviously you want your child to be motivated to go to it. So there's this concept of high preferred environments and low preferred environments. I want to make sure that the bathroom is the most highly preferred, because going from a high preferred to a low preferred is much more difficult for children. We want to keep the general environment fun, but we want to make sure the bathroom is the most fun place. So they should be able to watch their most favorite movies in the bathroom, have access to their most favorite toys while sitting on the toilet. Again, during that time, make sure the bathroom is the most interesting place. So the step one is you're going to motivate your child to go to the bathroom. Step two, you're going to limit any obstacles. So the first thing I want you to do is I want you to keep very little clothing on your child. Generally, I have my patients wear just a little t-shirt and some underwear. You do not want to wear a diaper. I repeat, do not put a diaper on your child. The biggest reason is you can't see through a diaper. Diapers are not, they're absorbent. You want to be able to see when your child's voiding. So if they start to have an accident, you want to be able to quickly catch them in the act and bring them to the toilet immediately. You can't see through a diaper. Do not have your child wear a diaper during the toilet training process. You can have them run around naked if you're comfortable doing that. There's certainly nothing against that. It's super easy to see if they're voiding, if they have nothing on. Whatever you're comfortable with your child running around in, just make sure it's minimal, make sure it's easy, loose, and quick to take off. Because if your child needs to go quickly, they need to be able to remove it easily. Don't dilute motivation for your child to void by allowing access to super highly preferred things outside of the bathroom. So this is my point. If the child's watching their favorite show on Netflix and then all of a sudden you have to interrupt that show to go to the bathroom, that's not going to be a fun or pleasant experience. Make sure those most favorite things are reserved for the bathroom. Also, don't give too much attention. If your child loves attention outside of the bathroom, minimize that interaction and attention, and then make it super fun and give them tons of attention as soon as they go to the bathroom. Again, we need to really make the bathroom a motivating place to be. So the general procedure for doing potty training is step one is you're going to take a baseline, okay? So you're going to take a baseline of how often your child voids. You need to check your child's diaper roughly every 10 to 15 minutes before you start potty training, and you need to see, or check their underwear, whatever, you need to see how often they void. The typical child goes about 40 to 60 minutes in our experience. Again, that can wildly vary. So we typically start with a 30-minute interval on the toilet. So what that means is we want to catch the child before they typically void, and we want to make sure that they don't accidentally void. Remember, also too, we want to take that baseline and reduce it by about 20%, because we're going to be pumping your kid full of liquids and food, so they're probably going to have to void more frequently. So the general rule of thumb is let's start with a 30-minute interval. Remember, this is called scheduled sittings. Scheduled sittings has a lot of good evidence to it, a lot of good research base to it, and it's been effective for every single one of our patients. So basically, every 30 minutes, you're going to set a timer for that 30-minute time. You're going to have your child go to the bathroom. You're going to have them sit on the toilet for 3 to 5 minutes. Typically, don't have them sit longer than 5 minutes. We don't want to make sitting on the toilet aversive. We want it to be comfortable. We want it to be calm. We want it to be low pressure. All right? So every 30 minutes, you're going to have your child go sit for 3 to 5 minutes. If they void, make a huge deal. Make a celebration. Make it like a small party. Make it fun. Make it a very good experience. If they don't void, say very little. Help them pull their underwear back up, get off the toilet, and go back exactly to what you're doing and wait for the next 30-minute interval. Now, as they successively void in the toilet, you're going to increase that increment by about 15 minutes. So you're going to go from 30 to 45 to 60 to 75. When they get up to 75, typically we're going to go, at least to about 2 hours after that. We typically want, a normal child should be able to void in the toilet every 3 to 4 hours. That's the goal. Ultimately, the goal is to not have to prompt your child at all. The ultimate goal is to have your child say, "Mommy, I need to go potty," and to run to the potty all by themselves and to go void in the toilet without your help. That's the ultimate goal. So we're increasing those intervals to try and give your child a chance to be aware of their body sensations and to be able to go void on the toilet themselves without your help. That's the ultimate goal. When the timer rings, again, I want you to excitedly mention it's time to go to the bathroom. I don't want you to prompt, do you need to go potty? It's time to go potty, let's go potty. The reason I don't want you to prompt that is because I don't want your child to become dependent upon that verbal prompt. I want you to gently take their hand, say very little, just go with them to the potty and have them sit on the toilet. And again, make it fun, light, interesting, interactive. I want you to minimize any kind of verbal prompting to do that. Remember, we're trying to transfer stimulus control to your child's biological sensation to go and then have them go by themselves. After they get off the toilet, reset the timer again for the time interval. Again, if it's after the third time they've been successfully, increase that by 15 minutes. If your child starts having accidents, what I want you to do is I want you to bring them to the toilet as soon as you see they start to void. Try to have them void or finish voiding in the toilet. If they do, still make a big deal out of it. Wipe them up, clean them up, put a new pair of underwear on, and then go back to the same time interval. If they continue to have accidents, that's something we need to troubleshoot at the end. We may need to decrease food or liquid intake, and we may need to decrease the time intervals. Also, consider having your child wear less clothing if they're consistently having accidents so that you can observe and be more responsive at the start of an accident to get them to a toilet. The other thing is you may want to get closer or stay closer to a toilet so that you have less time to travel between there and the toilet. If they do void in the toilet again, make a big celebration, make a big deal out of it. Even if they started having an accident, voiding in the toilet is a big deal no matter what, especially when starting out. Okay, as they progress, I want you to extend the time and I want you to add more clothing to make it more natural. Obviously, typically children aren't going to be able to walk around environments outside of the home naked, and they're typically going to have underwear and a pair of pants or shorts on in addition to a t-shirt. Remember, let your child practice removing and putting on their own clothes. This is something they're gonna have to learn how to do at some point. So if they're not very good at it, you wanna give them practice at removing that. Again, for a small child, for a young child, make sure the clothing is loose at first, make sure it is easy to take on and put off. But as they get better, make that clothing more realistic to what they're gonna wear throughout the day. You want your child to become aware of their own body signals. The way you're gonna do that is by obviously increasing that food and liquid intake at first, but by extending those intervals. That's gonna give your child a chance without that prompt. Let's say the time interval is at 90 minutes, but let's say at 75 minutes, your child needs to go. Well, what we really want them to be able to say is, Mom, I need to go, I'm about to potty, and then run to the potty and void. That's the ultimate goal. So again, be very strategic about increasing that time and minimizing the amount of prompts that you have to give your child. Okay, so troubleshooting. Let's say we're having some issues. So some parents will say, Jake, my child screams and cries when I try to bring them in the potty. They just don't like doing it, and they don't like being interrupted from what they're doing to have to go to the bathroom. Okay, so there's a couple things we can do here. Number one, again, go back to make the environment, the bathroom environment, more fun. Make it more interesting. Put the most preferred items that your child wants in that bathroom. The second thing you have to do, though, is make the outside environment less fun. So you've got to make the environment that they're in less interesting, provide access to less preferred toys or items. So let's say they have 5 favorite movies. And let's say some of those favorite movies are less preferred than the most preferred movies. We'll only let them watch the less preferred movies out in the living room, but may have them watch the most preferred movies in the bathroom. So again, it's about making those environments motivating. Second thing, limit the attention the child's getting outside of the bathroom. Make sure to save that attention primarily for being in the bathroom. Third thing is you might be reinforcing some of that crying or tantruming behavior in the bathroom. So what I want you to do is limit your reaction, have your child sit and void, and do not talk to them until They're sitting on the potty doing appropriately what they need to do. When in doubt, block access to every other reinforcer, every other distractor that you can, and withhold that attention for any kind of approximation of appropriate behavior, such as your child gets quiet, your child stops screaming, your child stays in the bathroom, your child tries to sit on the toilet. Again, make it as comfortable as possible. You might need to change the toilet seat. There might be some kind of factor. Just you got to do problem solve a little bit and make sure that you're optimizing the comfort and motivation of that environment. Okay, so if your child is not consistently voiding in the toilet, this is the second kind of problem parents typically report is, Jake, I put them on the toilet, but they never go. I swear my child can hold it for hours. Sometimes children are scared, they are a little worried, and it is uncomfortable for them and unfamiliar to void in the toilet. So number one thing we have to do is we have to increase their body's biological motivation to. So you have to increase the food and liquid intake. So if they're not voiding, then that tells me that they're just not biologically motivated to go. So remember, you want your child to have so much food and liquid in them that they're darn near begging you to go to the bathroom because they have to go so bad. So you want to increase that food and liquid intake. Second thing you may want to do is increase your time intervals. Maybe you're sitting too frequently, and maybe, again, it is aversive, and maybe your child just doesn't have to go. Maybe their body's digestive process is a little bit slower than you predicted. That's why you want to, again, focus on that baseline. But if your baseline's kind of wrong, then you may need to adjust that time if they're constantly not voiding. All right, so let's go to the opposite problem. The third problem is, again, the child's having too many accidents. Remember, to limit those accidents, you want to stay closer to the restroom. You want to have fewer clothes on, fewer obstacles to take on, take off, and you want to decrease that food and liquid intake. Maybe the type of food they're eating is too much of a laxative or too much of a diuretic. Let's say there's something with caffeine in it, I don't know, something your child's drinking. You want to decrease that food and liquid intake, decrease that biological motivation to have to void so frequently. Now, I have had children where, I'm going to go back to that potty chair point. I have had children that biological processes are just, they're not on a good pattern, they're very unpredictable, and even with the increased food and liquid intake, their scheduling avoiding is very erratic. So only in this scenario have I ever allowed a potty chair to be used is if your child's having infrequent accidents so erratically, what I will do is I will allow parents to get a super comfy, super playful potty chair that's very comfortable for your child to sit in, and I will allow that child to sit on that potty chair for extended periods of time while watching movies, playing games, interacting with people. The reason I do that is, number one, is if the child's sitting on a toilet the whole time, it's almost impossible to have an accident. And number two, it just decreases those obstacles to having to travel to the toilet and having the child. Some children just have very poor bowel awareness. They don't know what it feels like to have to go to the bathroom, and they haven't linked that biological sensation with, I've got to go, to needing to go to a different environment. So if this is the difference between your child successfully voiding in a toilet or not, this is the only time I recommend using a potty chair. Now, as your child does successfully void in the toilet, we need to make it a big deal, and we do need to eventually transfer that potty chair into the bathroom. We need to transfer that potty chair onto the actual toilet seat, and then we need to eventually just get rid of the potty chair and only use the toilet. So we will need to transfer that process from the potty seat to the toilet, and we can do that in sequence steps. And you might want to, like I said, consult a professional when doing that to make sure that you have a good, solid plan. So parents, that's the basics of potty training. If you do all of those steps in a very consistent, logical, consistent way, I've had many typical children be able to be potty trained in 1 to 2 days. Many children can be trained quickly when parents use a very strategic approach like the one I just described. So we want to thank you for joining us today on Ask the Behavior Doctors. We want to thank our photographer, Mr. Philip Carnevale of Philip Carnevale Photography. We want to encourage you to continue submitting those questions to us at info@scottsdalepbs.com. And we want to thank you again for joining us here at Scottsdale Pediatric Behavioral Services and Ask the Behavior Doctors.